So question number 3 here is, how long does the result last? Are there any side effects? Are the result reversible? Hello, my name is Dr. Matin and I'm from Pulse Light Clinic. Today we are going to talk about the nose and non-surgical rhinoplasty and the most Google questions or most research questions on these very important topics. So the nose occupies the central portion of the face and has a prominent effect on facial profile. Thereby it helps with establishing the character of the mid-face, and it has a profound social, emotional and also functional significance on our face. That's why today we decided to talk about the most Googled questions on non-surgical rhinoplasty. So I'm going to go through them one by one. First question, can I reshape my nose without a surgery? Alright, so the short answer for that is yes, but it needs a thorough examination to establish and to find out what is the problem. Okay, not every single nose and every problematic nose can be sorted in non-surgical way. There are still a great portion of the nose that needs to do a surgical correction, but the short answer is yes, there are many corrections that we can do non-surgically. Question number 2. How does a non-surgical rhinoplasty work? Well, non-surgical rhinoplasty, it's a fancy name for that, but essentially we're using dermal fillers. We're using these gels to inject in the nose and change the shape of the nose. For example, if you have a small hump on the nose, or if you want to lift the tip slightly, or to make a narrower ridge on the face, or even creating a ridge on the nose, we can use dermal fillers. We can use toxin as well, botulinum toxin or Botox, to relax the muscle which pulling down the nose tip, sometimes to just help with the lift. So question number 3 here is, how long does the result last? So that is depend on the type of correction on the nose that we do and the type of fillers that we use, because fillers that we use on the nose is different from, for example, what we use on the lips or other areas in the face. Depending on that, it's somewhere between 12 to 18 months before you need to top it up again. Question number 4. Can a non-surgical rhinoplasty fix breathing problems? No. The answer for that is no, because when there is a breathing problem, that means there are some issues inside with deviating symptoms or like a collapse septums in the nose, which non-surgical rhinoplasty cannot help with that. With this, we can only change the appearance of the nose or the reflection of the light on the nose, which in terms that will change how we see the nose. Question number 5. Is non-surgical rhinoplasty dangerous? Yes. We practitioners, when I'm a trainer and when I teach, we establish the most danger zones on the face, which one of them, the most danger zone on the face being in this area where the nose and the between the eyebrows or glabella areas is the most dangerous zones in the face, because there are a web of the arteries in that area which they all interconnect anastomose to each other, and they all lead to arteries which supplying the eyes, and if anything goes wrong, if inadvertently it's injected into one of those arteries, it could well affect the eyesight and even cause blindness. So this procedure has to be done with someone with experience and the skill to do this procedure. What are the benefits of non-surgical rhinoplasty? Well, we know that these days in this era of the smartphones and computers, we see ourselves much more, and minor problems on our face could affect the self-esteem and our confidence. So correcting a very minor problems on the nose, if gives somebody more self-esteem and more confidence to go out there, that is the benefit. So medically it's not much of benefit to do this, but it's more about how you see yourself and the image of yourself. Question number 7, are the results reversible? Yes, if you use non-permanent dermal fillers, what we usually do, it is reversible. So if you don't like it, or if there is anything like for example a problem or injecting into a blood artery happen, so luckily there is a agent that we can reverse this and we can dissolve the filler almost immediately. And the last question, question number 8, are there any side effects? So like all dermal fillers, all injections on the face, there are side effects like bruising, swelling, asymmetries. Significant side effects could be if a blood artery gets affected or blocked, a part of the skin that blood artery, that blood vessel supplies can die and fall off. Blindness in worst case scenario can happen if one of the arteries which goes inside the eyes or anastomose with the ophthalmic arteries gets affected, then blindness could happen, but all of that it's manageable, it's not immediate. So once the practitioner pick that up, it can be managed before it gets to the next level. That was the most Googled question that we could find here, and we discussed them. But if you have more questions, please, you can write a comment, you can contact us, or if you have a concern about your nose or you want to see if you are the right candidate for this procedure, please book a consultation with me. We are here to help. Thank you for watching.